Good evening, everybody. Thank you for joining us for answering the call in a time of pandemic. My name is Ben Wood, and I'm the Director of the Division of Community Health Planning and Engagement at the Massachusetts Department of Public Health. And I've been asked and am thrilled to kick off this event. But before I do that, a few housekeeping items. Today's webinar will be recorded and available for viewing at a later date. By participating in this webinar, you are giving consent to be part of a recorded session. At the bottom of your screen, you should be able to see a Q&A option available. Please feel free to post a question at any time during the webinar, and the moderators will do their best to answer as many of your questions as possible. Please also note that the chat function will not be available, and participants' cameras and microphones will be disabled throughout the webinar. So thank you again for joining us. And before I introduce Anna Maria Ciega-Reese, the Dean of the School of Public Health and Health Sciences, I wanted to give a few thanks to UMass on behalf of the Department of Public Health. It goes without saying that this has been and continues to be a tremendously difficult time. The impact of the pandemic has laid bare existing inequities, and public health as a field has been challenged. In so many ways, it's hard to even begin to recount them. Partnerships with schools of public health have been critical during this time, and I wanted to lift up two examples that UMass has helped make possible. First, I want to thank the 94 students, faculty, and alumni at UMass that have been part of the Academic Public Health Volunteer Corps. Stem from the Coalition for Local Public Health's request to bring additional support and resources for 351 local boards of health in our state. The Massachusetts Academic Health Department Consortium developed the Volunteer Corps to connect volunteers to local public health departments to strengthen their response and to build their capacity. UMass volunteers, along with 12 other universities and colleges, have provided somewhere around 19,000 hours of service to 127 local boards of health since April 1st of this year. A special thank you goes to Amy Gilbert-Loinez, Assistant Director for Internships and Employer Engagement at the School of Public Health and Health Sciences. As a co-lead for the Academic Public Health Volunteer Corps, her leadership has assisted with the recruitment and deployment of volunteers from UMass Amherst. Thank you, Amy. Secondly, I wanted to thank the School of Public Health and Health Sciences, and especially Risa Silverman, who is the director of the school's Office for Public Health Practice and Outreach, for their ongoing support of the Western Mass Health Equity Network. The network is a really important connecting point for advocates, public health practitioners, and really anybody who cares about our region who wants to make it a better place to live and thrive. Risa's connections to the community and their university help bridge important gaps, and during this time has continued to act as a convener and planner to advance health equity in our region. It is these sort of community-facing and capacity-building efforts that will help us get through this emergency and are shining examples of what academic partners can be doing to make our public health system better. So now to introduce Dean Ciega-Reese. Dean Ciega-Reese has a really extensive bio and resume, which I can only do half justice to in a short period of time, but to give it a brief try here, her research focuses on the first 1,000 days of life by understanding the influence of maternal weight status and dietary patterns and etiology of adverse pregnancy outcomes. She explores important topics such as the early determinants of childhood obesity and the association of maternal preconceptional health with childhood eating and weight status among Hispanics. She also examines the critical topic of the determinants and consequences of food insecurity and implications of food policy and health outcomes. Dr. Ciega-Reese currently serves on many national and international committees that advance public health knowledge, including, and this is just a sample, as a Board of Trustees member for the International Food Information Council, and also as a member of the Food and Nutrition Board, which is part of the National Academy of Sciences. So I wanted to really highlight that last one because I believe it means that we all now know who to turn to when we want to get birthday cake back on the dietary recommended food list. Dr. Ciega-Reese has received many awards and acknowledgments, including the American Public Health Association's Food and Nutrition Mary Egan Award. And prior to coming to UMass, she held many key positions at the University of North Carolina School of Public Health, including most recently as Associate Dean for Academic Affairs. Dr. Ciega-Reese holds a bachelor's degree in public health, woohoo, from the University of North Carolina School of Public Health. She has an MS in nutrition from the University of North Carolina at Greensboro, and then back at Chapel Hill, she received her PhD in nutrition with a minor in epidemiology. And in addition to being the Dean of the UMass School of Public Health and Health Sciences, she is a professor in the departments of nutrition and biostatistics and epidemiology. On a more personal note, I will say that as a member of the school's community advisory board, I have seen a distinct change in energy and momentum at the school since Anna Maria has come over to beautiful Western Massachusetts. I'm excited to see where the school goes under her leadership to tackle the big issues of our day, and I'm now very happy to pass it over to her to get this event started. Anna Maria?
Thank you, Ben. And I have to say, you're not the first person who's tried to advocate for getting something on the dietary guidelines. My partner wanted me to have Oreo cookies on there. So I want to thank everybody for being here on this special night during UMass Homecoming Week. As Ben has stated, the COVID pandemic has changed the world in which we live, work, and play. It has increased the general population's awareness of public health, which is a good thing, and the fact that we are all connected as citizens of this globe. It has also, unfortunately, highlighted the inequities in our society, as Ben mentioned, and in particular, the social determinants of health that we care so much about in our School of Public Health and Health Sciences, which are education, housing, employment, daycare, and transportation. As you heard, our school has played a very important role in the understanding both the spread of this disease and in contact tracing. We have the forecasting hub of Nick Reich that you've probably seen in the news numerous times forecasting the number of deaths from COVID. We've had Rick Peltier from the Department of Health and Environmental Sciences in the sanitation of N95 masks. And we've also have had faculty members do research on the impact of COVID in special populations. And those faculty members include Liz Evans, Aline Gubrium, David Buchanan, and Irene Martinez, just to name a few. In fact, we've been involved in so many different aspects that some of them you'll hear tonight in more detail, but there's a full report that you can find all of the activities that our faculty members have been active in. And I'm going to put the report in the chat room, and you should be seeing it, I believe, on a slide as well. Okay, let's see if we can get this to work. Sometimes these things take much longer than we like. Here you go. All right, excellent. So without further ado, let me introduce to you our faculty and students who are joining me tonight to tell you a little bit about our school's response to the COVID pandemic. First, let me give you an introduction to some of our wonderful students who've been involved in the contact tracing efforts. We have Isabella Caruso, who is currently completing her MPH in Community Health Education from the Department of Health Promotion and Policy. She is a 4+1 student who received her BS degree in Public Health Sciences this past spring. We have Parker Sweet, who's also a 4+1 student. He's in his senior year as a Public Health Science major, who will then go on to complete an MPH in Health Policy Management from the Department of Health Promotion and Policy. We have Tay Snyder, who's a second-year doctoral student in the Department of Epidemiology, and Johanna Ravenhurst, who's a second-year Masters of Science student in the Department of Epidemiology. And our faculty, we have Andrew Lover from the Department of Epidemiology, who's an assistant professor with expertise in infectious disease and disease surveillance. Laura Balzer, an assistant professor of biostat, an expert in causal inference and cluster randomized and pragmatic trials. Sarah Goff, in health promotion and policy, an associate professor and pediatrician who conducts health services research on issues of quality and equity in our healthcare system. We have Karen Helfer, who is a professor and chair in the Department of Communications Disorders and expertise in speech and audiology. Lynn Beatty, who is an extension nutrition education person in our Department of Nutrition. Lynn has been intimately involved in producing nutrition bites that you'll hear a little bit more about later. And last but not least, Gwinnell Laik from the Department of Kinesiology, who's an assistant professor who runs an oxygen and muscle metabolism lab that you'll hear about some of the new exciting research he's doing on post-COVID hospitalization. So let me start by asking the group some questions. And I'm going to focus now on our COVID UMass process and response. So Andrew and Laura, the university has established a premier testing and contract tracing program. And for that, we know you have just given numerous hours and given up some teaching to be able to do that. Can you please tell us a little bit about what we've learned about what's working well this semester and how we can potentially apply that for the spring?
Certainly. So I think the experience so far really shows that rapid contact tracing and isolation of cases and a full response across different levels of the university really allows for rapid containment of any potential infections. Some of the important challenges are the complexity of the response within Massachusetts and the lack of county level departments of health makes the political side of public health a bit more important than potentially it is otherwise. And then really the need for larger public health investments. And I think over the last few decades, the public health workforce has not been funded and supported the levels it needs to be. And so that all really shows that the program and the efforts of the contact tracing initiative are really building initiative and momentum for larger scale public health.
Thank you. Laura?
Sure. Thanks so much for this opportunity, and thank you all for being here. So I just want to highlight that as of this morning, we've cracked over 95,000 tests since early August. This has been a huge investment and endeavor, not just in public health, but across our campus, and really speaks to interdisciplinary communication and action. One thing that I'm particularly proud of UMass is unlike a lot of other universities and colleges, thus far, we've taken an approach to not blame and shame students and instead work with them in a compassionate way. So if someone tests COVID positive, they are not punished for that. Instead, we can work together with the contact tracers to immediately act and try to minimize the spread as much as possible. And I think lessons learned for spring term is really how we can engage more fully with our student population, especially those living off campus, as well as the larger Amherst community, to understand what are the wants and needs and concerns for all parties involved. And that's really a public health perspective that will give us the proactive prevention that we need to keep COVID-19 at bay. Thank you.
Great, thanks. Can you tell us a little bit about how we've been able to keep the spread under control?
Andrew, you want to take this one?
Sure. I mean, certainly we're testing at a really incredible clip. So on-campus students are twice a week. So that's among the highest in the nation. So the really high level of testing, as well as the adherence among student populations has been really fantastic. And so that regular testing to catch asymptomatics has been incredibly successful. And then our turnaround time for interviews of cases has been a median of 2.5 hours from the lab report. So the state DPH guidelines is within 48 hours. So we're doing incredibly well. And that's really due to the hours and hours of work by the contact tracers and nurses and case interviewers. So that, nitty gritty interview, person-to-person interaction is really what's driving all of this, as well as what Laura mentions, that students are willing and able to share, potentially sensitive information because it's in a non-judgmental setting. That's definitely helped all of our responses.
Great, thank you. And that leads perfectly well to talk a little bit about our contact tracing and the students who volunteered for that effort. I must say that I'm just really very proud of them, and they have done an amazing job of sharing messaging on social media to encourage appropriate behavior. And I believe there is a slide that will show you a little bit about some of their fun messages that they've shared. Could we get that slide up? Hopefully it will come up so you can see it. There you go. So this was a really nice one on the left-hand side of one of our contact tracers in New York. But what's also neat about this is it was a very interactive social media post that allowed students to respond to whether or not they've been tested. And so I think that's great. And then on the right, you see the fact that we're trying to create a campaign about wearing our mask and why is it that we wear a mask. And you actually see two students that have the School of Public Health and Health Sciences masks that we've helped fundraise for. And I was very thrilled that our advisory board provided some support. So students, I want to ask you this question because you've really gone above and beyond. Can you tell us what has motivated you to participate in this effort? I don't know who wants to go first.
I can start.
Okay.
It's been an honor to be part of the UMass contact tracing team. So back in March when the pandemic was kind of at the real, I don't know, so deep into it, I actually joined the volunteer corps and started helping out contact tracing there. And through the Mass Department of Health, I learned all these skills, and that's why I joined the UMass team.
Great. Okay. Others?
I guess I can go next. So in general, I just wanted to support my community and find a way to do that. I think a lot of people were trying to figure out ways to do that during this time. And also I was aware that contact tracers are needed in order to minimize the spread. And that's a really important strategy that we had during the pandemic. And I know that they didn't, at least at the beginning of this pandemic, have the staff members to do that. So I thought it was really important to get as many people on board as possible.
Great, thank you. Parker?
Sure. So my first year, my seminar instructor said two things that stuck with me. The first is lift as you climb. And the second is pay stuff forward. So personally, that's what's motivated me here. And professionally, I'm taking operational knowledge that I learned as a contact tracer at Partners in Health and managerial experience working as a team lead for the volunteer corps. And so this personal aspect and professional aspect set me up exceptionally well to take a leadership role here. And so we're able to take our efforts, pay that forward to a cohort, which pays it forward to a campus, which ultimately pays it forward to a cause. And it's been absolutely rewarding and incredible.
Great, thank you. Johanna, how about you?
Hi, so I also worked on the Academic Public Health Volunteer Corps, and I wanted to bring my experience from that back to UMass, to my local community. And I was excited about the opportunity to train and support a team of undergraduate students here at UMass. And I think we're all learning together here in the center, and we're collaborating to find new ways to stop the spread of COVID-19 in our community. And it's really just been exciting to work with them as they develop as public health professionals and prepare to graduate and enter the workforce in this important time.
Great. Can you all tell us a little bit about how the students that you've had to call responded to this program? And it might be sort of helpful for the audience to hear a little bit about, you know, what's the typical protocol? How do you start by asking these questions of like, who have you interacted with and where have you been? Any one of you.
Sure. Let me try to take a stab at this. So when I was working on developing the scripts with Amy and Andrew and Esty over the summer, we all put our heads together and we figured out that compassion is the way. In public health, we work with people's strengths and we meet people where they're at. So during these interviews, you're not being prescriptive. You're working with the person. You know, we accompany people through their entire journey, and it does start with the interview.
Great. Does anybody else have something to add?
Yeah,
Isabel?
just going off of that, I think people respond very well with us because we are students. We understand this situation. We've, you know, been in different situations that make us more, I guess, understandable and compassionate, as Parker said. So I think the response has been very well.
Yeah, I just wanted to say it's been an important opportunity. For the most part, students have just been asking questions and we've been helping them talk through their quarantine or isolation plan. And one example that I want to highlight of how much of a community effort this is, some students have even been reporting second exposures to us and extending their own quarantine. So that really highlights how it's a community effort and we're building trust with them and working together.
Hey, do you have anything else to add?
Yeah, so I just wanted to say I was actually really pleasantly surprised with the level of disclosure that most of the students have when they're talking with us. So you might think that someone who has been interacting with other people might not want to disclose the names of individuals they've been in contact with, but for the most part, we actually have been getting pretty complete disclosures. So I think the level of trust there is pretty good, which also could be because we are also younger and can connect with them on more of a personal level. But in general, I think that it's been going well in part because of the relationships that we can have with the students.
Great, thank you. And we really do appreciate it. Let me move on to Sarah. Sarah, as a physician and a faculty member, can you tell us a little bit about the importance of maintaining student and faculty mental health and well-being during this time period? You're on mute.
That would help. Thank you. Thank you for that really important question. I wear these different hats, but they're not really different hats. They all sit on my head at the same time. So I know very early in March, one of my earliest thoughts as students that I was supposed to be teaching in Cuba returned unplanned, unexpectedly, abruptly. And we started discussing how they were feeling about the pandemic. And these were in the very early days. But it was quite clear that there was a great deal of stress and anxiety. Not surprisingly, this pandemic is a perfect storm of uncertainty and isolation that is a recipe for making existing mental health concerns worse and bringing on new ones. So from then coming forward, there have been a great number of interventions and efforts across the campus. And to second what somebody said earlier, interdisciplinary work has been really the key for this, and thinking as a community and working together as a community, which has been really wonderful to see. I've only been at UMass for not quite 2 years, and I've been really impressed with how the groups have come together. So some examples, and I don't pretend to know all of the things that are going on to support faculty, staff, and student mental health across the campus, but some noteworthy examples that show the interdisciplinary nature of it too are from the Center for Teaching and Learning, partnered with the Student Affairs Center to get a resource ready, very short, ready to use set of places that they could refer students to if they were encountering students who could use support. So it was really easy for faculty or staff or administrators, whoever encountered a student who they felt could benefit from having access to these resources. That was made quickly available. And there has also been a lot going on within the departments in terms of making a set aside time for students to just drop in and check in, obviously via Zoom, but to just talk about what's going on that have been used in the School of Public Health, certainly. And professors and faculty are starting off classes with check-ins, from what I understand, even more than they used to, which feedback from students is that matters. That matters that someone who they spend time with each week in the faculty role is showing that they get it, they understand, they're caring, that that this is a really, really hard time and it can have mental health effects. And then for faculty, there have been, it's been really just strongly supportive from administration on down, from things like extending the tenure clock to giving additional time for preparing excellent online courses. So that level of support, while not directly necessarily addressing mental health, gives that support and time and recognition of what people are facing, you know, in their daily lives, with either with children at home or with aging parents, and that there's a lot going on. And I think that has been really meaningful for faculty to have that level of support, and that has supported mental health. And then the last thing that I want to bring up, and there's incredible examples of it right here with our students, is that one of the things I did with my class that came back from Cuba is quickly pivoted. I wanted to teach them qualitative research methods, get them started with learning that. And so we started doing interviews with students and healthcare providers and what we call the freestanding citizens about their experiences with COVID. So a group of 4 of these students, and we have added some more along the way, really ran with this. That once the semester was over, they wanted to keep working on it. So they've brought it to the level of submitting a manuscript just 2 weeks ago, which is really impressive for undergraduates, like really impressive. And one of the really interesting things we learned in our conversations is that they said that activity, that doing something to pitch in, to help, to generate new knowledge in and of itself, and having that community group that they were working with, that research group, really made them feel better and feel like they are making a huge difference. So there are multiple other examples of that. I know in EPI course, they're doing a survey now, exploring students' experiences, and people in the classroom have gotten students involved in additional projects, and that can also be preventive for helping mental health concerns as we walk through this COVID journey together. So yeah, thank you.
Thank you. That's great. I know as a teacher and teaching first-year students, there's no question that the students are very appreciative of coming together once a week. And even though every once in a while we'll get off topic, you know, it's nice for them to have the opportunity to interact and be able to talk about what's on their mind and what they've been doing to sort of establish routines and stay healthy. So yeah, very key. And speaking of that, you know, Karen Helfer, you've been very much interested in helping our community members, and especially our community members in nursing homes who are not able to get out and be in touch with their family members, which is really hard. Can you tell us a little bit about this program that you developed, and not only about what you did, but how did the nursing home individuals respond to it, and how did that impact the students?
Sure, Anna Maria, thank you. So when the pandemic broke out, I was trying to think of a way of involving our students. Like Sarah just said, you know, I think one way to make people to do some good is to do some good and to make you feel better. So at the same time, I was thinking about older adults in residential facilities and the fact that they no longer had visitors, and in many cases were confined to their rooms, even for meals. And because my research is with hearing in older adults, I know about the potential negative impact of social isolation in the elders. And, you know, I knew that it was even worse now than it was before. So I thought about mobilizing our wonderful SPHHS students to reach out to older adults in these residential facilities to help combat this isolation. And my idea was that they could write letters and cards and maybe have conversations via video calls. And so this came to be what we call the Elder Companionship Project. So I put out the call for student volunteers, and within a few days, I had just about 50 volunteers signing up, both undergraduate and graduate students from all 6 SPHHS departments. So the response from the students was really overwhelming. So we started a letter writing initiative with about 12 senior care facilities, mainly in Massachusetts. We did have one in New Hampshire. And the students sent letters and cards and artwork. And some of them actually established ongoing pen pal relationships with the residents, which was great. And then I came across an organization called the Massachusetts Senior Care Association, which is a private organization devoted to improving the quality and delivery of long-term care services in Massachusetts. And I reached out to them primarily as a way to get connected with the senior care facilities, but they had another idea, and their idea was to do an additional project, which was to have the students make short videos of support for residents of facilities and short thank you videos for staff working at the facilities. So we did that, and we had this great response from the students. I think we had about 40 students involved. We sent these videos to the Massachusetts Senior Care Association. They distributed them to their member organizations. And then we had our terrific SPHHS staff take those videos and make montages. And those montages we shared with the facilities we were working with. And the montages, if you'd like to see them, are also, I believe, still up on our SPHHS YouTube channel. So I would encourage you to take a look at them. They're really heartwarming. I think that the senior care facilities were really excited about this opportunity. You know, I think they were struggling to do something for the residents. And actually the hardest part was trying to figure out who to get in touch with at the senior care facilities. And the key was getting in touch with the people who were the activity directors. And it was really the activity directors who saw the need for this. And I think I only had one facility turn me down, and it was only because they already had a similar project going with another organization. So how did this impact the students? Well, I think I'm going to call upon one of the students, because one of the students who participated is here, and it's Taya Snyder. So maybe Taya, you could say a few words about what you think about the project.
Yeah, definitely. So my involvement started with making some videos. So I did make a video for the staff and then a separate video for the residents. And I even got to get my dog involved, and I had my dog doing some tricks on the video. So that was fun. And then I started with the letter writing, and it was really nice to kind of reach out to people. And although I didn't get responses back, even just for me, being able to reach out to some people in the community was nice. And it was also kind of relaxing to do artwork and put some skills into the card making for the residents. So I thought it was a fun experience.
Thanks, that's great. Yes, and I've had a few other students reach out to me to tell me that they found it very meaningful. And again, I think I've had 3 people say they have ongoing pen pal relationships. And I think one testament is that I think about a month ago, two student organizations actually took over the letter writing campaign. And so it's continuing as entirely student run now, which I think is really terrific.
That's wonderful. Thank you so much for sharing that. It really is an outstanding community project, and that's great. So Lynn, you have another aspect of the community. So we know that the impact of COVID on our food supply has received much attention in the news. Can you tell us a little bit about eBites and what has been your message to community members about procuring food and eating healthy during this time?
Sure. So UMass Extension's nutrition education program wanted to remain present in the communities where we serve. So our team created a weekly newsletter that highlights helpful information about food safety, a healthy recipe to try at home, and physical activity ideas to try, and mindful meditation and stretching, gardening, and then resources to food access in Massachusetts. Our collaborators printed and enclosed this weekly newsletter in food pantry bags for clients. It was shared on social media platforms and on our website, as well as other collaborators' websites. In response to procuring food, we also included information about making the most out of what was in your freezer or in your cupboard, trying to limit trips to the grocery store, and reducing food waste. And the newsletter was also translated to Spanish, so it was distributed in English and Spanish.
So
sorry.
I'll mute myself first. One of the things you hear about, as a nutritionist is the fact that people have had more time to literally focus on meal planning and preparing meals and encouraging participation from all family members. Can you tell me whether or not you've seen sort of that happen in communities? Do you think these kind of positive behaviors might be lasting past the pandemic?
I hope so. The response and reactions from our local agencies that we work with is that they're finding that the newsletter is really useful. It's the perfect amount of bit of information for their staff as well as the participants. So.
Well, great. Thank you so much. I know the community members have appreciated that greatly. Okay, so now, Gwenal, you were just funded to do some interesting work related to understanding the recovery of post-COVID hospitalized patients. Can you tell us about this project and why is COVID an important condition to study given your interest area?
Yeah, sure. So actually, this project started, and the idea of the project started back in spring, just by watching the news and seeing some people that had been hospitalized for several days and actually a couple of weeks, and you could tell that they had lost a lot of weight, a lot of muscle mass. They would have a hard time walking around, and so being in kinesiology, in the department of kinesiology, that's we're sort of in some ways familiar with these situations, and so I started to look at the statistics, and clearly over the summer, the statistics were showing that 1 in about 5 people that contract COVID end up being hospitalized. So that's quite a lot of people. And when they are hospitalized, they tend to spend 10 to 15 days at the hospital, which is kind of a long duration for an hospitalization. Usually they get some heavy treatment, they have very little activity, and so over 10 days to 2 weeks, this certainly produces some damage in the entire systems of the body. Also, we know that the people that tend to develop a more severe form of COVID-19, the people that tend to be hospitalized tend to be older, or tend to have pre-existing medical conditions. And so all this, observation that sets the stage for what's called a catabolic crisis, where you have people that are more vulnerable to disease, that are going to have a hard time recovering, and so you need to find solutions to help them recover quickly. If you're 30 or 40, it will take you maybe a few weeks, a couple of months to recover from 10 to 10 days at the hospital. If you're older, you really need a lot of help. And so realizing that, we were trying to find ways to improve the physical rehabilitation of these people that had been hospitalized. And it's actually currently difficult to even go to a clinic to get some physical rehabilitation. And so we came up with this idea of using heat therapy, where you have actually people having so we have a system that can be used at home, and you can actually heat up some parts of your body, and this heat therapy can replicate a lot of the health benefits of exercise, but it's a softer way of doing an exercise. So we have a clinical trial that is about to start I think in about 2 weeks. We should be finally ready, and we've been funded by ALGS to get this started, and we have a collaboration with Bay State Medical Hospital, and several other faculty in the department are involved, and so we're going to start this project very soon, and yeah, we are ready for that.
Well, we can't wait to hear about it in terms of the results that you find. And I think it's one of the lingering questions that we'll all have in terms of what are the long-term health effects of COVID. And I'm sure that we'll be dealing with that in many different aspects. I'm going to turn now to some of the questions that have come in through the Q&A. And so if our panelists, if you feel like you want to respond, if you can just please unmute yourself and show your video, that would be awesome. I'm going to start with this first question that says, you know, with case numbers surging across the country and around the world, what do you think lies ahead for us in regards to this pandemic? Pretty broad question. Well, let's see if our faculty members have some.
Yeah, certainly. Right now, especially in Europe and the colder climates, we're seeing a very large surge in cases. And the best guess there is it's probably due to colder weather coming on and people spending a lot more time indoors. And we can certainly expect to see something similar here in the Northeast through the fall and into the winter. The clinical trials that are now ongoing for 3 to 5 to 10 different vaccine candidates are all enrolling and moving along well, but it will be a while before those analyses are complete and then the approvals will happen. So we're in a bit of a pickle for the foreseeable future. And vaccines, the National Academy of Medicine estimates that best case scenario, all Americans will have a vaccine within 12 months from approval. So I think it's important to realize that this is, a long-term process and goals. So probably planning well with your family and your community and thinking about next steps is important. But we're very lucky to be in Massachusetts with a very strong and well-funded public health department, which is not universal across the country, certainly.
Mm-hmm. Great. Laura?
So I definitely agree with Andrew that the outlook is pretty bleak right now, but I think we could learn from that in a way, or at least plan ahead for the future, in that we heard a lot about resilience and supporting each other and compassion. And despite the coming on of winter weather and everything else that gets crazy around the holidays, we really need to come together and continue to be a community that is engaging every single partner in this fight against COVID, which is everyone from my dogs in the background to children to people that are living off campus, students living off campus, as well as faculty, staff, administrators, our host community, and really have these hard conversations and long conversations about what we can do to keep up with this fight and not let down, because many of us are tired, but we really need to come together and be compassionate and support each other.
So Laura, you just hit one of the topics, and Sarah, I think you're going to be able to feed into this next thing too, so just keep your camera on. There were 2 questions that have come in through the Q&A, and one of them talks about the coronavirus fatigue and how it seems to be affecting everybody, and what strategies and really kind of programs that are out there that can sort of help individuals keep up their knowledge, attitudes, and behaviors about mask wearing and social distancing and hand washing. So how can we do that better? And what efforts are out there? Sarah, would you recommend that we need to do as we're now headed towards, right, all these events that we're normally used to gathering family and friends?
Right, thank you. That's another big question. So we have a pretty good idea of what works, and it's really kind of low budget public health, mask wearing, distancing, but it's really, really, really hard. We're social human beings, and back to mental health, there are a lot of unintended consequences of doing the right thing from preventing transmission. So trying to be able to be with people, if that is something that people are desiring, and that's common, it's not for everybody, but that's quite common, is figuring out ways to do that while keeping risks not zero necessarily, but lower. So what does that look like? Outdoors bundled up if you're in cold weather spaces can help. Zoom is not perfect, but it's a connection if people have access to that. Because what I was going to comment on from the last question, and it applies to this too, is continuing to not just be mindful, but really being advocates for health disparity populations who are, as we're in this for the long haul, it's more likely that those disparities are going to spread rather than close. So, advocating with government, local, town, state, federal, to do what we can to help support the populations that are going to have it the hardest for this long run. And that I think also ties into the what do we do about being together and supporting a lot of different cultures and different ways of people being together and trying to help problem solve to do it as safely as possible.
So here's a question that our students can chime in is how has the university and our school helped support you through the transition to remote instruction? Thought I'd let the students answer first and then the faculty can add.
I can say that I think the professors have been checking in with us more frequently, making sure that we have everything that we need and being upfront with them if someone has a technology limitation or a struggle in that area. And they're also being a lot more flexible with deadlines and kind of making an individualized decision depending on the specific circumstances that each person is in. So it's been really nice from my perspective.
Some of the other things that we know of that have been done to help support students is the fact that there has been, for some of the first year students and international students, there was a workshop prior to the semester starting that gave them some skill sets about learning online. There has also been support for students in terms of some funding for computers. And I think the biggest thing is making students aware of the fact that what we want them to do is learn and communicate with us. And so most students have the option of taking their courses as pass-fail. Tay, did you have anything else to add there? I see your block. No?
No.
Okay. All right. We have a question here that I think, Andrew, you might want to weigh in on. And the question is, how effective is the strategy of closing access into a state from other states?
Yeah, that's a difficult problem. Certainly our economies are very well connected, especially, in smaller states here in the Northeast. So it is not really a very feasible solution to have some kind of a cordon around a state to keep trade to a minimum. So it's really a matter of collaboration and cooperating with other departments of health to try and gap fill where needed, to have a more coordinated program so that the general programming is more consistent across state borders.
Okay, here's another question, getting back to the students. How are students supporting each other during these times?
I think students are really supportive, especially in these like awkward breakout rooms. Often we start talking to one another and just kind of checking in and figuring out like what each other's, we're doing. I am a student as well as a TA, and I really appreciate like joining a breakout room and they're just kind of chatting about, how they're with everything and what they're doing. So I think normalizing just like we're all kind of in this together is a great way to continue.
Anyone else want to answer that question?
Yeah, absolutely. So like Isabella, I'm also TA for Public Health 301, Principles of Community Health Education. And I've worked with Dr. Deanne Gerber to integrate kind of group norming into team-based learning like you would, just like you would in person. We also do check-ins every week and stuff like that. So much like the faculty are involved with us about conversations, ongoing conversations about how we're in this together, what we can do for each other. Students are doing that organically as well, which is incredible.
Great. So we have a question from one of our audience members who's an alum, and they want to know, how can the alumni assist in supporting students? So this is open for everybody.
I would say to continue on several themes across this this discussion, and I think that's such a wonderful question. Thank you for asking it. And I meant to mention earlier, I'm a double alum of UMass, so it is really special for me to be part of this, in addition to having multiple UMass degrees in my immediate family. So I'm really, really delighted to be here with the alums, being one of you all. I would say if you are in any kind of a role, workplace, where you might be able to bring on a student, 2, 3, 4, to do some of the work related to COVID that may be touching your workplace, then that might expand the opportunities that we've been talking about on the beneficial aspect of, getting involved in mental health, but also skills building through applied work related to COVID. So it won't work for everybody, but if you are in a situation where that you might be able to do that, I think that the students that we've seen are super responsive and just really add an awful lot to any project work that's going on related to this.
So just building on that a little bit, I would also say many of our students lost out on their summer internships opportunities. So not related to COVID, but realizing that COVID will pass and these students are still missing out on opportunities to learn and grow and get experiences outside of our tight little academic bubble. And so I think the alumni network could be a huge strength to support students in all types of research or activities, COVID related or not. So thank you.
And I'll end on this last question for the group. How can we advocate for stronger public health infrastructure support and policy, both in the state and at the nation? I'll start by saying, make sure you vote in a couple of weeks. Does anybody have any other advice?
You took my first one, Anna Maria, but I don't know if it works, but I know I, in March, went on a letter writing campaign and wrote to every governor in the state, pleading with them to to take leadership on distancing and mask wearing. It obviously didn't work for a lot of states, but I think that's one way. And Massachusetts is generally, I think, doing a remarkable job with that. So it's harder if we live in this state, but then also working, there's still a few more weeks left to election, working on phone banks in those states where they're on the fence and those calls can make a difference. There are quite a few of them that may work, and keeping an eye out for actively looking for those types of advocacy opportunities, and picking the one that suits you best.
Certainly, there are a whole range of bills in the state Senate right now to expand the public health workforce, as well as funding for regional level response offices. So definitely email and call your state representatives to support those. And really just kind of use this, unprecedented, horrific pandemic to push some positive change at the state and national level through public health expansion.
And I think this is kind of a related question, and it will be the last question we get to answer, is what could UMass and its new networks do in terms of pandemic preparedness leadership? Any thoughts? We did have, Andrew did a special course this summer. We are trying to use different case examples, right, of COVID in our coursework to sort of get students excited about entering fields of public health. Andrew, Laura, any other thoughts? Karen?
I think certainly this highlights the very interconnected nature of public health. Just building the contact tracing network, the School of Public Health started interacting regularly with the School of Nursing and a whole range of IT departments that none of us had ever heard of on campus, all doing very important work. And so it's really been important to figure out all the kind of aligned allies and work together toward a common goal.
Karen?
I think in our field, we had to pivot very quickly to telehealth. So we have a community serving clinic, and we have students who need to be trained as clinicians. And so very rapidly, we shifted to providing services via telehealth, and we had experts in our department like Dr. Mary Andrianopoulos training clinicians on the state level and beyond in how to do telehealth. And I think that's going to continue after the pandemic. I think the genie's out of the bottle now.
That's great. And Laura, did you have?
Yeah, I just wanted to again highlight Andrew's remark about it really being a massive interdisciplinary collaboration for any of this to work. And I think many of us in public health, especially epidemiologists and biostatisticians, are in the spotlight for the first time. And I'm hoping that it continues to be a happy, warm spotlight, and that we can use that momentum moving forward at a national level to really gain appreciation for what public health is and how it can be similar, but also different from much more individual-based clinical medicine.
Thank you for those fine last words, and we're going to end there. And I want to thank the panelists for joining me tonight. This was, I think, very engaging and fun and informative. To our audience, thank you for attending and allowing us to showcase our wonderful faculty and students during the UMass homecoming celebration. If we didn't get to your questions that you submitted, we'll try to answer them by email. And I want to do a special call out to the UMass Alumni Association for helping us with the logistics of this event. And everybody, I hope you have a good night, stay healthy and active, and I wish you all a very wonderful evening. Goodbye.